a pushy broad from the Bronx, New York. Follow her voice, a straight dog is nice. She's a pushy broad from the Bronx, oh yeah. Don't be surprised if you wanna listen twice. Make decisions, find the right choice. Know yourself better, find your own voice. It's okay if you need help today, cause everybody needs a little push. From the pushy broad from the Bronx, New York.
Welcome, Transformation Talk Network listeners. My name is Ellen Stewart, and I am the pushy broad from the Bronx. Welcome to my show, Recovery Recharged, where I share advice and support from experts in the field of addiction and recovery. I have a very special show for you today. It's about a topic that has been coming to my attention through my clients and through professionals and also through family members. And you have also written me and asked me certain questions. This show is going to be about unveiling the shadows. We are talking about navigating the maze of sex and porn addiction. So hang on to your hats, listeners, because I have an expert here today, and we're going to answer all the questions and look at this very prevailing topic among our addiction population today. I have a very special guest. Her name is Joann Anderson. She is a licensed clinical social worker. She is a clinical sex addiction therapist. She is a certified clinical trauma professional, and she is a licensed certified alcohol and drug counselor. She's a psychotherapist with over 35 years of practice. She specializes in addiction, trauma, PTSD, and mood disorders. Joann is a graduate of Columbia University, and she also has a Certified International Institute for Trauma Professionals certificate as well. So she's also EMDR trained and DBT trained as well. I have brought a professional to my show today because we have some very, very difficult questions to answer, and we want to make sure that we get the right information and we get the most up-to-date information in this field. So I am sitting down with Joann Anderson, and we are talking about sex and porn addiction. So let's start with the very, very basics. First of all, the Pushy Broad from the Bronx, Recovery Recharged, is very happy to introduce my special guest this morning, Joann Anderson. Good morning, Joann. How are you?
Oh, I'm great. Thank you so much. And what a beautiful introduction. I appreciate that. And I'm happy to be here.
You're welcome. Thank you so much. I am very happy to have you. Can you explain a little bit about what sex addiction is? I mean, nobody knows what that is. So maybe from a clinical point of view, a couple of sentences on what it actually is.
So, sex and porn addiction is really hypersexual, compulsive sexual behavior, thoughts, or patterns that involve over preoccupation or overwhelming preoccupation with sexual thoughts, feelings, and behaviors that often interfere with one's life, create negative consequences.
Okay, so that sounds very much like what we do here on Recovery Recharge, because addiction is an over preoccupation with a mood altering substance. So could you talk a little bit about the differences between porn addiction and sex addiction? So where do they meet and where are they different?
So, good question. So, for porn, both porn and sex addiction are what we refer to as process addictions. So, they don't involve a substance per se, but maybe like food or gambling, they are a behavioral addiction. Most, say, porn addiction is our baseline for sex addiction. So many times porn addicts don't necessarily become sex addicts, but most sex addicts started with porn, early exposure to pornographic images, feedback, and that sort of laid the groundwork, lit up the brain in such a way that they wanted that high, that dopamine hit each time that they went back to it.
I understand. And that's very interesting. You said that sex addiction normally starts with porn addiction, but porn addiction doesn't always translate into sex addiction. So that's a
Right.
very interesting thing because when you talk about porn addiction, I remember, the Pushy Broad is dating herself here, but we're talking about the old Playboy magazines and the centerfolds, and where people were actually watching or seeing, right, images of things in magazines or reading about it in
Right.
books. What kind of porn addiction happens today? Where are most of our porn addicts finding these images?
Well, because of smartphones and the escalation really in technology, this is where we're seeing this grave, huge escalation in pornography. When I started as a CSAT, a certified therapist in this area, most of my clients were middle age. Now, what we're seeing because of smartphones and technology that really began around 2001, many of the problematic users that I see are in their 20s. So I think what I tell them, the good part about that is you can get help early on. You don't have to be in your 40s, 50s, or 60s, and then half your, many of your years of your life is gone, and now you're getting help. You can get help early and therefore have a healthy, intimate sexual relationship or intimate relationship later on in life where it's not problematic. So with high-speed internet, with VR and AI, it's just booming essentially.
And that is very interesting. And you hit the nail on the head because you're right. I had seen where you're in this 35 years, I'm in this 20 years, in terms of addiction, process addiction, and substance addiction. The people that came to me with a dual diagnosis, they had substance misuse and they had sex addiction, were much older, 40s, 50s,
Yeah.
60s. But now, of course, with the advent of these things happening, or just the images and the stimulation happening readily available, it is now porn and sex addiction with 20-year-olds. And you're absolutely right. It opens the door for hope. That's for sure. So somebody that doesn't know, let's say it's a 20-year-old out there that's
Yeah.
not really sure whether they have a sex or porn addiction, or they're
Yeah.
just exhibiting normal sexual urges. What's the difference? Tell me
Yeah.
so we can tell these guys, talk directly to them and tell them what they should be watching out for.
So a few things. Is there for you an overall preoccupation with pornography or sex? Do you think about it and so it predominates maybe your day, your relationship? Do you are you compulsively looking at porn? Now I can't give you a number or frequency, but is it repeated? Does it interfere with your job, with school, with duties at home? Are you isolating? Are you, are you withdrawn? Have you encountered financial problems because of it, or medical problems? Failure to perform sexually. These are all sort of consequences that you might see. Just an inability. Have you tried to stop on your own and you couldn't?
You're absolutely right. You hit the nail on the head. And that's exactly what you have to look for. And of course, it's the frequency. How how much are you preoccupied with this? How much does it interfere with your day? How much is it interfering with the rest of your life in a negative way? For sure.
Right.
You're absolutely right. Okay. So, in your professional experience, what are the potential psychological and relationship impacts on these addictions? What happens to their loved ones?
So loved ones experience profound grief, sadness, and betrayal. For a partner, um, they often can end up with complex PTSD or post-traumatic stress. They question themselves. They often are gaslit by the betrayer. No, nothing's going on. I'm not doing anything. You're imagining it. Those sorts of, the partner ends up feeling crazy often. So the deception, the lies, and the dishonesty really break away at a partner's self-esteem, their sense of self. It creates dissatisfaction sexually between the two people. She or he may often feel inadequate, have low self-esteem themselves. She may often feel shame and guilt for staying, for not recognizing it. Oh my God, how could this be going on for many years and me not know it? They often partners can become very good private detectives. So they dig and dig and dig. They might dig through emails, text messages, financial records to sort of validate their own sense of what they feel reality. But it really causes relationship breakdown and dissatisfaction. And that's why we call it sex addiction is an intimacy disorder.
Okay, so I'd like you to define that just a little bit more because it's very interesting. Just explain a little bit about intimacy disorder because you explained it really well in terms of how the loved ones feel, for sure. So explain why you call it an intimacy disorder.
So often when we look at the psychological origins of sex addiction, or really many addictions, there is sometimes a sense of failure to attach in our younger years to a parent or someone, a caretaker, who's reliable, who's always going to be there. When we find sex, porn, a drug, whatever it is, that is reliable. We know when we turn to sex or porn, we're going to feel good. We're going to get a dopamine rush. And porn and sex addiction become very transactional. I give to you, and I get a feel good. There is no intimacy if someone goes to see a prostitute or goes to a massage therapist or looks at pornography. There's no intimacy in that. It is a transaction. And that's part of the difference.
That's very real, and I know that you have helped a lot of people by clarifying this. So it's rather difficult for somebody to have the courage sometimes to sit in front of you and talk about their addiction for sex and porn. So when you start out with them and you start approaching, talking to them and treating them, what's it like? How do you begin with them? Where do you want to go?
Well, the first thing that I'd say I do is really create a warm space and build a rapport with them. I also want to celebrate their being brave at coming into therapy and sharing their most intimate thoughts, behaviors with me, because that's a huge step. I try to normalize for them and really sort of break through some of the shame and guilt, that they're not alone, that there's lots of support out, and I'll go through that with them. Lots of types of therapy. There is hope, and they can get better. So, usually maybe they've done some research on their own, or they've looked at my website. So they've made a huge step in coming to me, and I just want to celebrate that for them.
Yes, I understand. So you mentioned shame and guilt, because I know it's a variety of things, and and addicts in general carry feelings of shame and guilt. Talk to us a little bit about how you would address those feelings, just in general. Clients coming in and feeling shame and guilt.
So I try to provide some psychoeducation on the differences for them, right? Guilt is I did something wrong. Shame is I am wrong. So it's an inherent sort of negative core belief that we can carry. For the betraying the person with the problem, them understanding the cycle of addiction, that shame will keep them in a negative spiral, that they often will be triggered. Maybe they'll then do the behavior, they will get a release, but then they'll feel shame after. They'll feel inherently like something is wrong with them, defective. And I want to explain this cycle to them. I want to tell them we want to treat the shame and sort of bring on some self-compassion, some self-understanding for them, because without dealing with the shame, it will keep them in that vicious cycle. They'll act out, they'll feel shame, then they'll go back to the behavior. It'll be a vicious cycle.
Do you find that treating sex addiction is very similar to you for treating substance misuse?
So there are similarities, right? Like many of the modalities we use, whether it be 12-step programming, a dialectical behavioral therapy, cognitive behavioral therapy, but there are some differences. With sex and porn addiction, we want to provide them information around their arousal template, or what are their fantasies that sort of began the development into what turns them on or what they're addicted to. We also want to treat, the difference is with substance addiction, they're evil, or they're addicted to a drug or substance. But here with sex and porn addiction, they're really, the evil they're addicted to is their relationship with sex. And we also do a lot more partner and family work with sex and porn addiction, because of its profound impact on the relationship, the primary relationship.
So let's talk a little bit about what that's like, because a lot of people confuse sex addicts with criminal behavior, with pedophilia. Explain that for us. Break it down, please.
Yeah, so most sex addicts are in no way, shape, or form what we refer to as offenders or engage in pedophilia. That is only a very small percentage, and not what I see in my practice, or probably what the majority of those in this field see. Now, with escalation in pornography, just like escalation with a drug, an addict can get more into deeper content, more perverse content, and they might get into, say, called child pornography, right? But it's because they go down these tunnels, and they're not inherently defective pedophiles or anything of that sort. It's because of the content that where they escalated in terms of what they were looking at.
In other words, there could be just inherently normal behavioral health
Yeah,
going on, and maybe a childhood trauma or a situation where the intimacy or the relationship problem is such where someone's preoccupation becomes an addiction. Would you say in
right.
many cases that was the case?
Yeah, absolutely. Absolutely. So, what may have started as curiosity at 13, the brain is not fully formed, we know, until, especially in males, till they're about 25. The brain is not capable of being able to metabolize those vivid images, especially what they see now at 13, at 15. So it lights up the brain in a way that the brain continues to ask for it. It creates a pathway that's negative, just like an amphetamine, like cocaine. They've done MRIs with sex addicts. They've showed them porn, and they see on the MRI that it lights up in a similar way than an amphetamine.
It's unbelievable. There are certainly many, many similarities, as you say,
Yeah,
substance addiction, process addictions. Okay, so because you do this and you've been doing this successfully, and because you mentioned before that there is hope, can you give us
yeah,
an idea what kind of treatment modalities you've had success with?
absolutely. So I recommend and emphasize for both my offenders, as we would call it, the betraying partner and partners, what we call the three-legged stool. And the three-legged stool is individual therapy, group therapy, and 12-step programming. So it's, they need that full component in order to have the best outcome. Also, maybe at some point getting into trauma and those underlying causes, psychological causes, depression, anxiety, that may lead one into this type of process addiction.
So, in many ways, it does mirror addiction recovery and sex addiction and porn addiction, even though it's happening in younger and younger people, and it's being infiltrated by technology and all kinds of other things. You're still finding that some of the old-fashioned treatment remedies, the group therapy, the 12-step therapy, and individual therapy, is having great success. Is that
They
correct?
give, absolutely, they give people the best chance at success. Absolutely. They really need all three components.
Okay. All right. So let's just talk a little bit about how you see the future of treating sex and porn addiction. Are there new therapies evolving? What do you see on the horizon that could be game changers?
So, interactive technology is something good that came out of COVID, have to say. So there's a lot more online therapy that has opened up avenues for a lot more people. There are groups online, individual therapy online, 12-step meetings online, all over the world, 24 hours a day. So there's a lot of access. There is also, they're looking at medication assisted treatment. Drugs they treat for like naltrexone or NAC that they use for alcohol and opiates, they are utilizing with this addiction and have found it helpful for cravings and urges. Also, therapies like neurofeedback, biofeedback, and a lot more holistic therapies we're looking at that really treat the whole person. So it's not just psychodynamic therapy or a lot of the other DBT, CBT. We're looking at the whole spectrum, and also really bringing in more of a family partner component is critical with this addiction.
Well, it's extremely important that families participate, that it is not that it is understood as something that people can get better from, right? They can improve, they
Absolutely.
can continue, they can enjoy normal lives. All right. So, Joann, I cannot thank you enough for being with me today. You've been extremely informative. I'm going to have you back because you are an expert in this field. If you have any
Thank you.
questions, please call Pushy Broad from the Bronx. Well, you can call me at 800-889-1757 and I will get information for you. Or you can go to pushybroadfromthebronx.com and make a consultation appointment with me, and I will make sure that you get the help you need. Thank you so much, and we'll see you next time. This is Ellen
All clear.
Stewart, the Pushy Broad from
All
the
clear.
Bronx, saying thanks. And remember, everybody needs a little push.
From the pushy broad from the Bronx,
Yep.
New York.
That's excellent.